Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. On today's episode, I'm joined by Dr. JT Finnell, the Chief Medical Officer at VisualDx. How are you today?
Great. Thank you for having me.
Yeah, I'm excited. We're kind of rocking the same hairstyle beard combo, which it happens more than you think too. It seems like everyone that comes on here has that now. Um, I don't know if you see the same thing, but every time I go to a conference now, it's super easy to see everyone that's kind of that's kind of like you.
Right. Yeah, one of my medical students thought I looked a lot like Moby, so I get that.
Sweet. um, well, I'm excited to have you on the podcast today. I'd love if you could start out by telling the audience a little bit about your background, and then we'll go through basically why, how, what of VisualDx and go from there.
Sure. So I guess firstly, I'm an emergency physician, trained in Vermont and California in emergency medicine. And so one of the things that I found frustrating as a medical student and a resident was just the amount of clinical data that we needed to sort of ingest and consume and process. And so my first job was in the Twin Cities in St. Paul, Regent's Hospital. I realized that I needed to tool up and have a different skill set. So moved here to Indianapolis in 2002, did a fellowship in clinical informatics and ran the fellowship here through last summer when I joined VisualDx as their chief medical officer.
And we were joking because of the many hats that you wear. We were like, what's the title we roll with for this one? So thank you for that quick intro. I appreciate it. I'd love to kind of shift focus to VisualDx now. Let's assume that some of our listeners have heard of you and some haven't. Let's assume they haven't though. Can you talk us through the why, how, what, whatever order you want for VisualDx?
Yeah, so again, as emergency physicians, if you come to our emergency department with a skin rash, you're probably not the first patient we're going to want to see. You know, there's no blood, there's no like lungs hanging out. And so, we're really geared up for critical chest pain, gunshot wounds, things like that. The skin rashes to us, while they're part of our core content, it's really not a strong skill set that many of us have. And so if you go to an emergency medicine conference, there'll be often lectures in dermatology. And that's where I found VisualDx initially as a clinician, is that it helps me take care of patients that I don't really have a strong skill set for. And now VisualDx actually has derm experts, so I can use my phone to take a picture of the rash or the image and then walk through a series of questions with the patient and answer those questions and come up with really a differential diagnosis that makes sense and gets us on the right treatment plan. So that's how I found VisualDx, and that's how I found and became a part of the company, is that it's a tool that helps me clinically every day when I work.
It's really cool when there's that overlap, when that actually happens. It makes you more passionate too about what you're working on continuously, right? You have that strong. All the companies that succeed have strong whys, and it's great to see that ties in with what you're building.
Right. So derm complaints used to be a complaint that everybody would avoid, and now it's a complaint that I go to and actively seek out because I know I've got a tool that will help me be a better diagnostician with those patients.
If it's okay with you, I would like to shift focus now to a question that I had regarding basically. I'm curious your thoughts on this. How would you say the acceleration of digital health um, continues to make positive impacts on medicine as a whole?
But I mean, digital health is a pretty broad topic, and I'd say in general, most of health is now being offered digitally. The days of paper charts and paper records are pretty far and few. In fact, when we have a downtime, it's really just concerning that the younger residents and medical students have never been on paper before. So everything we consume now clinically is a digital resource. The problem, as you allude to, is that because everything's digital, it just makes it more available. And so that's the challenge that we face as clinicians, is trying to figure out which piece of the puzzle is really clinically relevant out of all the clinical data that we're being faced with.
And, in terms of the rise of digital health, it's super promising. And what you said about really everything's kind of digital health focused now. I saw someone mention the other day, I can't remember who it was, or I'd give them credit for it. So if someone listening said this, it was you. Um, but they were saying like healthcare a couple years from now won't even be healthcare. Everything will be digital health in some capacity, right? Um, and it's probably under that greater digital health umbrella. We're going to start putting more categories under that because they have a digital health presence. But in terms of the rise of digital health, super promising. But that being said, the rise can also contribute to information overload. So, can you describe basically how this ends up happening and why is this problematic?
Yeah, so another saying that you may have run into is data is the oil of the 21st century. And so everything becomes clinically relevant in some capacity. And that's part of the problem is that as we branch out into genetic medicine and that DNAs are being sequenced, and if that information ends up in your medical chart, it becomes more personalized healthcare, right? That certain medications that I may prescribe for one patient may not be as effective on another patient. And having that genetic data could potentially help us make more informed and better treatment decisions. And that's the problem that we're facing now is that at least in the emergency department, it's an extremely busy clinical environment. We're interrupted, I think, on the average of every 6 seconds. And so you can imagine if we've got a list of clinical data that we're trying to run through, as well as a lot of information that we're trying to sort out, which is relevant, which is not relevant. That's sort of the problem we face clinically on a day in and day out basis. And so having tools like VisualDx that can basically sort the information for us, prioritize information that's more relevant is what we're looking for.
And is like artificial intelligence and machine learning, can those technologies be utilized to combat some of this overload in your opinion?
Oh, absolutely. I think, that's sort of the promise of some of these tools and technologies is that you can take a list of clinical information, clinical data, and then using humans as well as technology to prioritize that information to make it more clinically relevant. It can also help refocus you. So, humans are biased. We have these internal sort of rule sets that we use to work clinically, and sometimes they're not entirely focused on what they need to be focused on. So if I'm working you up as say a chest pain patient, I'll get interrupted at least several times by other providers, by nursing, by medical students asking questions about other patients that I'm managing in the department. It's not unusual for us in the emergency department to be managing more than 20 patients at a time, sometimes 40 patients at a time. And so trying to remember which patient has which disease and which medication allergy can be challenging when we're interrupted and constantly faced with a lot of data.
And you kind of already alluded to a lot of this in your answer to the previous question, but if there's anything you want to add to it in regards to the question I'm about to ask you right now, please do. But it's really around, so continuing on kind of assistive technology, and I think you could put obviously AI and machine learning as assistive technologies. How can those be used to basically continue to allow providers to practice at the top of their license and do so, maintaining job accuracy and efficiency?
Right. So there's a volume of clinical data that comes out daily that we have to be on top of, and it's really not reasonable for clinicians to be able to stay on top of all that. And as you expand that data set to include genetic medicine and other specialties within a medicine, it's just really hard to be on top of all of that. So having tools like VisualDx that will keep us, clinically focused and clinically relevant. What are the right treatments? I mean, I think folks are aware of COVID, right? And so treatment algorithms for COVID almost change daily for us. And having tools like VisualDx can help make sure that we're making the most informed treatment decisions, the most appropriate medical therapies for that patient population we're seeing.
Last thing before we kind of wrap things up here, what's next for VisualDx?
So the future is bright for VisualDx. While I mentioned initially, I found it as a derm tool, right? So it's basically a tool to help me manage dermatologic conditions in the emergency department. We're expanding both into primary and emergency care. And so it's not going to be just a derm tool. It's going to be something that every primary care and every emergency physician can use in their daily practice.
Well, I'm excited to hopefully have you come back on the podcast. We can talk about some other topics, but super excited for your first time on the show, and really appreciate you coming on.
Thanks for having me. It was fun.